So I'm going to interrupt all of the very robust conversations that are happening at the tables and bring everyone back together to the room. And we have our web-based audience back with us as well, so welcome back. So we have some time now to kind of collectively coalesce our reflections from the room. And I'd like to start with just giving people the opportunity. Nobody is responsible for reporting back everything that happened at their table. I should have said that at the beginning. I feel like that's always an anxiety when you have tabletop breakouts. So I'm not going to spring that on anyone. But I'd like to spend just the first few minutes just asking if anyone would like to share a highlight of something they heard from someone else at their table. Just anything you think you'd like to pass on to the rest of the tables. And we have two people with microphones who will come to you if you would stand up and share something exciting from your table. Yeah. And please remember also to tell us who you are and give it a minute until someone can bring you a mic, just to make sure that we're being inclusive for our web audience.
All right, thanks. My name is John Wong from Singapore. And actually, we have the privilege of having Lisa Berkman on our table. And I was asking Lisa to expand on the the slide that she showed that maternity leave had a great impact on women post-65 in reducing the incidence of depression. Is that, yes, yeah, that's correct. And so actually that was the one thing that that was one piece of information that I wasn't aware of. So I wanted Lisa to expand on it. And I think Lisa was sharing with us that actually workplace health and the workplace environment, actually let me call it the workplace environment, may be the area which we may want to put more focus in terms of interventions, because that's, well, number one, we spend most of our life at work once we're past a certain age. And it's the interventions in the workplace which may have consequences which we can really benefit from in the future. So this issue of actually allowing employees to have either flexible schedules or the ability to be able to have more control over over how their time is spent actually may have an even bigger impact on possibly the lower social economic members of the of the team, because those are the people who probably are juggling with even more issues, and having that ability to perhaps take time to actually care for an aging parent, or care for a sick child, or even to have their own medical care, may have a greater impact than we actually realize. So I think this issue of workplace environment is one intervention that we should certainly take a look at more closely. And maybe Lisa, you can do you want to share any of your preliminary? Well, yeah, that may not be fair. Okay.
But I want to say, yeah. I'm thrilled. You said it really beautifully.
Any other tables with someone who has something they're really excited to share with the room?
Okay, hi. I'm Charlotte Ye from AARP Services, Inc. I had an awesome table because we represented the UK, Africa, Australia, and the US. So it was a very, very diverse conversation. I would say there were three things that came out of this. The one that really struck me, and thanks to MOSA, talking about in Africa, they really have lost that middle generation because of HIV, et cetera. So two observations. One is, it turns out then the older folks who have always been respected, that aging generation, turns out they are critical to the community, and how important that sense of purpose may be towards aging well. And the second comment that he made about this was, if it's really about prevention, that means we're already too late for the current generations. And if we really focus on prevention, the payback it will be years from now. And is there any policy, public sector, private sector that has the patience for that? Right. And then the second thing was really, this is our request of the commission. We think it's really, really important that you define healthy longevity. Our conversation said most of what was being discussed today was about how long you live and how many years. And we said, really, when you think about healthiness, our consensus here is financial security, it's health security, it's mental well-being, it's cognitive well-being. It is really far more holistic. And when push comes to shove, if you were to ask us, we say it really is subjective well-being. And maybe the measure is life satisfaction. So when you kick the bucket, were you happy with life? And finally, we also worry that if it's only about better health, then we may be creating an environment where you don't want disability, and yet we can cope with disability. And maybe the real answer is teaching adaptation, coping, and resiliency.
Exactly, a natural report backer. Anybody else with something you got really excited about at your table that you want to share with the room before I start really pushing?
Takumo, yes.
We'll start back there and then we'll come up here to Linda. Please tell us who
Laura
you are.
Karstensen. I was impressed by our conversation at our table by a comment that Takumo had made about the Japanese population and how it differs from the United States population, and that in Japan, citizens expect the government to solve these problems and to address them. And in the United States, we tend not to, but rather see these as individual problems that people have to deal with themselves. And it made me think how powerfully influential that is on the growing disparities that we see in the United States, because we're not expecting general solutions, but expecting people to do it on their own.
Go ahead, Linda. Sorry. Would you stand up? Thanks.
Sure.
The magic is all in the mic on house right.
Thank you, Jenny. So I'm reporting on behalf of a fabulous group. I'm just a mouthpiece here, Linda Fried. So we were wrestling with what a future back vision might be. And we're not sure yet, but it was clear it needs to be disruptive, that the present is not satisfying, and therefore just improving it won't get us there. We talked about aspiration from Michael quoted Amartya Sen, saying we want to create the conditions for people to lead lives that they have reason to value. And then we have to make a huge leap if we want to go with that in terms of what that would look like in a world of longer lives, and whether healthy and how the aspiration of healthy longevity could capture that as both a goal and a resolution of inequity, if everyone had the opportunity for that. There was a very strong statement that saying that everyone is different is a cop-out, and that, in fact, what we need to do at a commission level is to arrive at some unifying expression of what are commonalities of needs and wants that need to be handled in a disruptive vision and solutions. I'm quoting from this amazing group here. Jenny Popey made a very important reference to one of her own studies that looked at what would a good place to live look like. And she said that when you look at people from a wide range of backgrounds and resources and experiences, that basically everyone comes up with the same answers. The difference is whether they can acquire it or not. And so do we need to look for deeply defining human principles of what healthy longevity should look like? Patterns of aspirations, social role responsibilities that people would love to rise to, that would be an enactment of what they would see as a desired healthy longevity, etc. So we ended up with a lot of questions and perhaps the beginnings of some guiding principles. Thank you.
In eavesdropping, I know I heard some other kind of disruptive change ideas, so I'll probe on those. But I think there might have been at least one other hand up over there to share from something you heard.
Hi, I'm Kate Bunting, and I lead HelpAge International's offices here in the U.S. And for those of you who don't know HelpAge, we work globally on the issues of aging, but with a real focus on lower and middle income countries. So our conversation sort of started about some of the disparities and the fact that there was not a lot of measurements that can really equalize or let us look at the differences between higher income countries. But we became centered on some work that Paul told us about that he's been doing under looking at innovation and this idea of loneliness and what is that measure of happiness and how could we look at this, and some work that they did on the perceptions of your own health and well-being. And I'm gonna shortcut it and say that I think that the result that he found is in a pretty advanced study was that the higher perception you have of your own ability to contribute and to be involved in society meant that you had better health impacts long term. Does that sort of get to it? I'm going to let you add to it. But I think for us, it started to touch on some of these same things that I've heard from a few tables of, is there a unifying principle? How, I guess, Linda, it is a little bit of a cop-out to say we're all different, but there is an acknowledged reality that, we are working across some very different cultures. And we did talk to that conversation a little bit as well in terms of how does it change across cultures. And I encouraged Paul to listen to a talk that I know is coming tomorrow by one of my colleagues from Vietnam and our intergenerational self-help clubs. Do you want to add anything?
Yeah, I'll just add a couple things just to cite other people's work. One, the notion of loneliness, it comes from the how do we measure healthy longevity, really is life satisfaction. And loneliness is more, this is Carla Parasinoto at UCSF, and she distinguished between loneliness, how you feel, versus the number of social connections, which is a transactional kind of thing. And it's really how you feel that governs the change in your mortality, your morbidity, and your healthcare utilization. And the other one I want to credit is Jennifer Acker at Stanford B School, who studies and writes about happiness. And the three aspects are, one, connectedness, two, meaning, and three, being a part of something bigger. And in our work on loneliness, those concepts came back. When we retire out of our jobs, those concepts are more and more important. And then the way it figures into how you feel then changes your life satisfaction, but literally the change in healthcare utilization and mortality. So as an example, I think many in this room know the self-rated health is one of the most predictive of your mortality utilization. And so I can talk about time banks a little later, but changing your feeling of loneliness will, for half the people, change their category one step. That decreases inpatient admissions by 30%, decreases outpatient utilization by 27% in another study. And I sort of replicated that in looking at our own group, the same 25% decrease just by touching this time bank, which gave you being part of something bigger, gave you purpose. So that power, that mind-body connection is incredible, and I think maybe that is the thing we need to measure as our measure of healthy longevity.
Would you just say who you are before you give the mic away, for the record?
Paul Tang, representing Stanford right now.
Thank you. Now, I know I heard some of you doing the kind of look in the mirror of your field and think about what major thing needs to change, what you might want to disrupt. Anybody want to share with the room what that was?
Okay, my name is Quinn Tran from Health Age International, Regional Office of Asia and Pacific. And our group has 5 members from Japan, from Thailand, India, UK, and also US, so from 5 different countries. And one area that we kind of was lacking here was relating to gender, was relating to older men. And the difficulty that many of our countries are facing is that the older men are facing probably much more difficulty in adapting to old age than even older women. And so a lot of, for example, a lot of our OPAs or Older People Association, a majority are women. Very few men participate. Very few participate. And most of our country, older women live much longer than older men. And so there's a lack of data, a lack of research, or a lack of interest on finding out what are the reasons, what are the causes.
It's 5:40 on a Wednesday in Washington, D.C. Time to take your stake on what you're going to disrupt. Go on the record. Any other pearls of wisdom from your colleagues you want to share back? Yeah.
Erwin Tan from AARP. One of the things that we talked about at our table was, again, measurement, this very difficult piece in how we can measure progress in terms of achieving healthier longevity, but also from some of the work that the Aging and Disability Independence Forum at the National Academy of Science, Engineering, and Medicine has about making sure that we don't overly conflate healthy longevity with a lack of disability, because there are people in the disability world who might object to the fact that if we only measure healthy longevity in terms of a lack of disability, there are people who age and become disabled, but there are people who are disabled and age with that disability, and to make sure that those lives are valued, so that we need to find a measurement that includes the ability to meet the needs that you want, or to do the things that you want to do that day. I think that's a CDC measure, but and also includes not only health, physical health, but mental health as well.
The mic is coming to you.
Hi, my name's Nancy. This is weird, eh? Does that sound okay?
Yeah.
My name's Nancy Morrow Howell. I'm from Washington University in St. Louis, Missouri. Our group talked a bit about language and how we need to change language as a reflection of really changing how we think, about aging and older adults. But one word that has come up, and I was afraid it was high up in the list of goals, was independence. So I'm just coming off Erwin's thing about, let's not view disability as something that we're going to stigmatize. I think we got to get rid of that word too, because that's really never a reality in any of our lives, any day of our lives from the day we're born, independence. So can we re-examine that word as we're going to use it? Because I'm sure it's going to be an important word in this movement. And people have suggested interdependence, but I just want us to challenge that word.
Hi.
Would you stand?
On that, I think a lot of people have written about how autonomy
Thank you.
autonomy is sometimes a better word, which is the ability to influence how your life works and take decisions and things, even if, like most people at all ages, you may need somebody else to actually enable those decisions to be realised.
Would you remind us who you are?
Sorry, my name's Emily Grundy.
Hi, I'm Sarah Locke from ARP, and at our table we had almost an opposite conversation about the principles of autonomy and independence. One of the things that we talked about and was informed actually by the Global Council on Brain Health and Hiroko Akiyama was part of that conversation that we had over a year and a half ago, thinking about autonomy as a cultural construct that's very Western in concept, and not only is it relative in the terms of culture, of that value, but amongst individuals, there's also a relativity of what it means to be socially isolated. That personally, you may be socially isolated if you are only having 3 or 4 people, but if you are an individual who feels the need to have lots of people around you in different constructs and different people, your ideas of social isolation could be vastly different. And the challenge of coming up with a scale that would be relative across cultures and individual expression of introversion or extroversion is something that would be necessary to be discussed, but it would be very challenging. And so ideas of autonomy and independence are quite different. The other thing I would say, we had a conversation about equity for what would need to happen in villages that could, from an economic perspective, create a substitution in well-being by just having numbers of people that you engage with, and that would seemingly not be dependent upon economics in terms of some of the things that we saw. Why is it that these economic differences, if social isolation and feeling connectedness is so fundamentally important to longevity, what is it about villages in all kinds of places that could substitute for the inequitable wealth? Anything else that we wanted to flag? Okay.
I think the other thing that we flagged that was mentioned before, and I just want to reiterate it, is the difference between what the role of government is, and someone was talking about in Japan, and that was so different. And in the slide that looked at how there was declining support for family welfare in the U.S. and some of the statistics about the U.S., which were quite unsettling. And so really thinking about policy and sort of the role of government is also an important piece in terms of longevity.
Remind us who you are.
Oh, Jones Lotnick.
Great. Any last burning desire before I wrap up the session to share? Well, thank you for bringing as much energy as you did to the tabletop discussions. It was actually pretty neat to be just walking around the room with that level of engagement happening. And many more of these topics are going to come up tomorrow and the next day. So we'll be able to keep going on these threads and keep poking at you to be thinking disruptively and about the future. So we've done some kind of distributed reflection. Now it is my pleasure to hand it over for a more concentrated bit of reflection. And MOSA is going to come. MOSA is a member of the commission from the University of KwaZulu-Natal in South Africa, and he's going to wrap up for us.
Thank you.
Oops. Would you take your badge off?
Good afternoon. I won't be long. My name is MOSHABELA from South Africa, and I'm one of the commissioners. I understand that the point is not to try and reach consensus, but is to be able to pick up on the different issues that people are raising and see how we take them forward. So let me first thank all of the speakers that participated today. Joanne, Victor, Jenny, Sir Michael, Lisa, Ali, Askar, Brenda, and Corey, as well as the moderators for today, Emily and Mildred. So I want to highlight a few things. One is that I get a sense that in as much as we agree that healthy longevity is about living longer with better quality of life, when you start to unpack that, I'm not sure that we quite agree. I think that there's a lot of variety of views around that, and we need to be able to find a way to catch the spectrum of the different ways in which people are thinking about those specific concepts. Borrowing from Animal Farm, I think that we can all agree that today's discussion was very much about the fact that all animals are equal, but others are more equal than, some are more equal than others. So inequality is an important theme of the day. In terms of identifying it as a problem, but I'm not sure that we are clear around how we're going to deal with it. And I think people have been talking about this for a long time. So, for example, Sir Michael was talking about how we could address it in country to some extent, but the moment you go between countries, you've got a bit of a problem. How do you deal with those variations? Even in country, when you have to deal with it, exactly how do you deal with it? Do we accept that it will always be the case that people will be unequal? The social gradient will exist. We have to work with it. Or do we want to disrupt that and make sure that, try to get to a point where everyone gets paid the same, for example? The reality is that either way, there are trade-offs. I think as Brenda put it well, that whatever decision we make, there will be trade-offs. And we have to be mindful of what those trade-offs are from the start. I think that I quite like the issue of dignity of life. And I want to highlight it from the perspective of, I think it was Lisa as well as Aska who specifically mentioned the issues of norms, values, and beliefs. And these issues we tend to live out a lot of times. And I think Lisa was talking about integration. And Aska spoke about norms, values, and the importance of context, which links to culture as well, that I think Corey also kind of elaborated quite a bit on. My issue is, for all of the things that we're going to discuss, and it comes out with the last discussion that was happening just now about the fact that what happens in villages, how do we define values, how do we define wealth, what value do we attach to wealth and how much? All of those things are not clear to me that we understand, and if we have to move forward with a roadmap, we have to engage with the complexity of how we understand those concepts. I get a sense that all this talk about purpose, about satisfaction and fulfillment will hinge a lot on these notions of dignity of life and culture and so forth. I also quite like this discussion that took place. I think it was Brenda who spoke about the rights-based approach and its importance. And I think a lot of the times when we talk about issues of justice, we tend to bring to the table the issue of rights-based approaches. But we also have to be mindful of the fact that, like as we would say about independence and autonomy, these concepts take a lot of hold in certain contexts and not in others. It's relative. And rights-based approaches, for example, in a lot of African contexts will encounter a lot of pushback for various reasons. One of them is the fact that they may at first, as they are introduced, contradict with the traditional values that are there. They at times may contradict with religious values, and people now have to grapple with how to reconcile them. And we cannot just put it out there without actually dealing with the complexity of reconciling different sets of values, including having to put forward rights-based approaches. And it's an interesting thing that we've seen, for example, in South Africa, where in schools we have adopted rights-based approaches because they are more neutral, and we don't necessarily have to deal with diversity of values, beliefs, and ethnicities in schools. But then when the kids leave school, they go back into the household where specific values of that house, traditional values, hold. And now they have to grapple with reconciling the different sets of values. So it's something to think about as we discuss further. The life course approach, I think that in general, I haven't had anyone disagree with it, but at the same time, I haven't really gotten from the discussions as to how we are pushing it forward. I'm missing that. I think that we are still very cautious about it. There isn't really anything that I felt like was disruptive about that I had. I think we're still very conservative. And part of the issue is what was reported earlier, is that I think Ali mentioned the fact that it's important to look at that middle age group from the data that he presented, which I accept. And I think Lisa also shared a similar sentiment, to say that we need to focus on that middle age group, especially if we're looking at outcomes around 2050. And also make a point that kind of caused a lot of cognitive dissonance for me about the fact that if you really want to look at those people, you must remember that they were born around 1985 already. And if you want to go earlier, it means that you have to project even longer. So maybe we should be projecting around 2100. Maybe we should be projecting around 2150. Would that be disruptive? I don't know. But the issue is our own limitations as individuals. It's difficult for us to see that far. But are we going to let our own limitations to kind of hinder our perspective of the time horizon that we attach to the roadmap? I mean, I'm sure according to the WHO, we're all thinking about the aging decade, and we're thinking as close as 2030. But at the same time, from what was discussed today, we know that that's a very short time horizon. So we have to be really thinking about it. I also like the fact that we are saying that, yeah, we don't want to worry too much about the, getting everybody to age of 110 or whatever, but we do want to make sure that we push the mean. But I think that if we are going to move forward on the life course in the next couple of days, it would be good if we can really start to push the envelope around exactly what we are thinking about it and how we would like to approach it. Finally, I want to talk about intersectionality. I think that it was Sir Michael who introduced it in the framework, but as I was listening to various people brought in a lot of complexity. Now, the complexity that I was hearing about, in a way, it does reflect the challenges that we have. And you see it both in terms of risks that people are talking about. You see it in terms of the different sectors that need to be involved. You see it in the way that potential solutions could come from multiple different places. How are we going to bring it all together? And I think Brenda mentioned twice the fact that we need to look at bringing together different sectors of governments in order to get data, but also in terms of intervening with programs. How do we do that? She also mentioned the importance of research partnerships from different disciplines in order to bring different perspectives together. And I suppose that goes with the discussion that was going on around involving business partners and others. There is a lot of complexity that's involved in the way we need to be thinking about the roadmap that basically comes from the fact that there are so many factors that intersect. and kind of predisposed to the problems that we have to deal with. I want to stop there, but say that, you know, as it has already been mentioned, I think that there's still a lot of questions that we need to address. I feel that we are still cautious in terms of this notion of being disruptive. We're still a little bit conservative. We really need to think about how we can be more disruptive as the next couple of days unfold. But also, I think that today, my sense was that people are struggling quite a bit with this notion of future back approaches. I think we're still kind of stuck in our sort of present forward way of thinking. And we really need to kind of reflect a little bit on that and think about how we're going to bring in literally the notions of future back, and then challenge even the way we are thinking about things today, the way we are doing things today, in order to make sure that we chase the sort of vision that we would come up with after this commission has been done. But thank you so much for today. I really enjoyed it, because I had to kind of summarize or pick up ideas from what people are saying. I found myself having to concentrate throughout. But I appreciate it. Thank you very much.
So there you've been given permission, probably the first time in your life, to be more disruptive, right? Or to at least think about how to be more disruptive. So I've got just a couple of things to say. I'm sure Iona will remind me if I say it, don't say it. We've got a wee break now, but if you could come back, because there's the launch of the roadmap, the global roadmap, at 6:15. And then if you can stay for that, then there's a reception at 6:30. That's back here. But so there's a bit of time to stand up, stretch. As they said on the Amtrak on my way from Florida to here yesterday, this is a stop for the smokers and the stretchers. Not sure it's for any smokers here, but anyway, the stretchers. So two other things. One is this will get you back in tomorrow, so don't lose it. Keep it safe, please, but you can take it away with you. And we start at 8:30 tomorrow morning. So please, if you could, get here. That's pretty early for those of you who've travelled a long way already, but 8:30 start. So it remains for me, as most of us said, we've said thank you to the speakers, brilliant, thank us to the moderators. I want to say thank you to you, especially those of us who've stayed the day, and for all of those who've been around, joined us, left, come back online. That's great. So I look forward to seeing you tomorrow. Thank you very much indeed.